this is actually the second time you've been to Dr. Zastrow's course.
Initial course is in Miami, 2017. Really a game changer for me in my practice. When I would go back in, and after doing a GBR, yeah, I mean, the volume would be there, but I'd go in and drill an implant. Sometimes it would feel pretty soft, and sometimes there's particles and what looks like maybe bone.
Yes, sir.
Just stuff. And
right.
Where this, it is 100% vital bleeding bone and unquestionable, just to the naked eye. You know, I actually had a patient where got a post-op infection, got the patient properly medicated, was able to save the graft. Would not happen doing a GBR technique. We would have lost the whole thing. If you're doing dental implants, this is a must course. I mean, it really is part of your day-to-day armamentarium of placing and creating and building bone. This is the course for you.